Welcome guys to my YouTube channel Study with Dr. Brainiac. Today we will discuss biliary secretion. Biliary secretion from the book G.K. Paul, first edition. So let's begin with our topic. Hepatobiliary system. Bile is secreted from liver. Human liver is secrete about 0.5 to 1 liter bile per day. Secretion of bile is important for digestion and absorption of fat. Functional anatomy. Bile is formed in the liver and excreted through the bile ductule. Bile ductule, along with the branches of portal vein and hepatic artery, form the portal triad. The portal triad open into the hepatic sinusoid. The sinusoid is surrounded by hepatocytes. The hepatocytes are in intimate contact with the sinusoidal blood. The bile canaliculi start at the space between two hepatocytes, which open into bile ductule. Bile ductule then form a bile duct which lead to hepatic duct. The right and left hepatic duct join to form a common hepatic duct. The cystic duct from gallbladder combine with the hepatic duct to form a common bile duct. Common bile duct combine with the pancreatic duct and open to second part of treatment through sphincter of Oddi. Composition of bile. Bile is greenish yellow fluid. Formed in the liver and stored in the gallbladder. It is composed of water 98% and solid that mainly include and pigment. Solid mainly include bile salt and pigment and different ions. Look at the table. Composition of solid human bile. Important point. Bile salt, bile pigment, cholesterol, inorganic salt, fatty acid, and fat, alkaline phosphate, cation, and anion. So these are the points. These are the ingredients present in the human bile. Now come to the color. The color of bile is greenish yellow due to the presence of glucuronide of the bile pigment. The bile pigment are bilirubin and biliverdin. Hepatic and gallbladder bile. There are differences between hepatic bile and gallbladder bile. As bile is concentrated and acidified in gallbladder. Water absorption is the major mechanism for concentration of bile that are secondary to sodium absorption. Sodium and potassium ATPase is the basolateral membrane of epithelial cell lining transports sodium actively out of the cell and create gradient for sodium transport into the cell. Water is reabsorbed passively by osmotic gradient created by sodium movement, as positive is exchanged with sodium that causes acidification of bile. Bile acid and salts. Bile acid, there are two types, primary and secondary. Primary bile acid are cholic acid and chenodeoxycholic acid. The primary bile acid are formed in the hepatocyte from cholesterol. Secondary bile acid are deoxycholic acid and lithocholic acid. The secondary bile acid are produced in the intestine, where intestinal bacteria convert primary bile acid into secondary bile acid. Bile salt are sodium and potassium bile acid. Bile acid are conjugated with taurine and glycine to form taurocholic acid and glycocholic acid. These acids are combined with the sodium and potassium salt to form a sodium taurocholate and sodium glycocholate, potassium taurocholate and potassium glycocholate, respectively. Functions of bile salt. Bile salt are primarily responsible for absorption of fat and fat-soluble nutrient. Therefore, bile deficiency cause steatorrhea. Bile salt perform following potent functions: absorption of fat, emulsification of fat, source of bile acid, bile secretion, absorption of fat-soluble vitamins, activation of pancreatic enzyme, prevention of gallstone formation, physiologic purgatives, stool color, gives color to stool, prevention of bacterial growth hormone, bacterial growth, prevention of bacterial growth. So come to the absorption of fat. Absorption of fat, bile salts are essential for absorption of fat from intestine. This depends on the formation of micelles by the bile salt in the intestine for their amphipathic property. Along with the lecithin and cholesterol, bile salts are cylindrical discs called micelles. Detailed in chapter given in chapter 51. Lipids are transported in micelles from the lumen to the membrane of intestinal mucosal epithelial cells, where micelles dissociate and lipids are absorbed. Emulsification of fat. Bile salts are surface tension reducing agent along with the phospholipid and monoglyceride. They cause emulsification of fat, which are essential for digestion and absorption of fat. Source of bile acid. Bile salts are converted to bile acid in the intestine, which are absorbed into portal blood. Thus, bile salts are important source of bile acid that add to the bile acid pool of the body. Bile secretion. Bile salts are important choleretic. They are constituent of bile and also they stimulate bile secretion. Absorption of fat-soluble vitamin. Bile salts facilitate absorption of fat-soluble vitamins. Hence, in obstructive jaundice, feature of deficiency of fat-soluble vitamins develop. Activation of pancreatic enzyme. Bile salts activate pancreatic lipase. Prevention of cholesterol formation. Bile salts, along with the lecithin, solubilize cholesterol. Thus, they prevent formation of stones in the gallbladder. Physiological purgatives. Bile salts act as a physiological purgatives. Constipation occur in condition of deficiency or delivery of bile into intestine, as occur in obstructive jaundice. Stool color. Bile salts add natural brownish color to the stool. Prevention of bacterial growth. Bile maintain pH of intestinal content and prevent overgrowth of bacteria in intestine. Enterohepatic circulation, important for university exams. Must read topic. Bile acid and salts are absorbed from the intestine and re-excreted in the bile, and this cycle is repeated so many times, which is called enterohepatic circulation of the bile acid and salt. The bile salts produced in liver 200 to 500 mg per day, and conjugated bile salt through biliary tract enter intestine. From intestine they are absorbed into portal blood to reach liver. Also in the intestine, conjugated bile salt is disconjugated and conjugated bile salt is absorbed into portal circulation. The free bile acid in terminal ileum and colon by the action of bacteria converted into secondary bile acid and deoxycholic and lithocholic acid SBA. Secondary bile acids are also absorbed in portal circulation. Thus, from gut, about 95% of secreted bile salt and bile acid are transferred back to liver by portal circulation, and only 200 to 500 mg per day of bile acids are excreted from stool. From liver, again they are excreted through biliary tract into the intestine. This forms the loop pathway for enterohepatic circulation. Enterohepatic circulation ensures preservation and utilization of various substances. For example, bile salts are recirculated 4 to 12 times a day. The substances that undergo enterohepatic circulation include bile salt, bile acid, bile pigment, vitamin D, vitamin B12, thyroxine drugs. Importance of enterohepatic circulation. The primary function of enterohepatic circulation of the bile acid and salt is to maintain total bile acid pool of the body. Total amount of bile acid, conjugated and unconjugated and primary and secondary, in the body range of 2 to 4 grams. Bile acid is cycled several times a day during meals, so that the small pool of bile acid can efficiently provide enough bile salt to facilitate adequate lipid absorption from small intestine. Though absorption of bile acid and salt from intestine occur efficiently, some amount is lost within every cycle of passage through intestine. This accounts for loss of about 500 mg of bile acid daily, which is replenished by synthesis of new bile acid from cholesterol. Thus, fecal excretion of bile acid accounts for an efficient medium for loss of body cholesterol. Determinants of enterohepatic circulation. The major determinant of enterohepatic circulation of bile acid and salt are integrity of intestinal epithelium to reabsorb them and efficiently of hepatocyte to pick them up from portal blood. Integrity of intestinal epithelium. Bile salts are reabsorbed mainly in the terminal ileum by an efficient carrier-mediated process so that only a 5% of intestinal bile salt enter the colon. Also in the intestine, bacteria deconjugate the bile salt to bile acid, and the bile acid are absorbed passively and easily as they are more lipophilic than bile salts. Look at the figure 42.2. We have to complete this remaining portion. Thus, intestinal absorption of bile acid and salts into portal blood is an important determinant of enterohepatic circulation of this substance. Further, bacteria convert primary bile acid to secondary bile acid that are also absorbed into portal circulation. Therefore, lipid malabsorption occurs in chronic inflammatory condition of intestine. Efficiency of hepatic uptake in the portal blood. Bile salts are transported bound to HDL or albumin. Once they have reached the liver, hepatocyte efficiently pick up the bile salt from the hepatic blood, which account for removal of more than 80% of portal bile salt. This hepatic uptake of bile salt is an important determinant of secretion of bile salt in the bile. Thus, hepatic uptake is the determinant of efficiency of enterohepatic circulation of the bile salt. Enteritis and hepatitis cause of lipid malabsorption. Bile salts are absorbed mainly in the distal ileum, and bile salts promote lipid absorption. Therefore, inflammation of lower part of small intestine that inhibits absorption of bile salt in intestine result in loss of large quantity of lipid in the stool, impair the uptake of the bile acid and salt from portal blood that in turn decrease their secretion in the bile. This also can cause intestinal malabsorption of fat. Look at the figure. Synthesis of bile salt 50 mg per day plus conjugation. It conjugates to form conjugated bile salts through biliary tract. It reaches to the intestine. Conjugated bile salt deconjugated in the distal ileum, terminal ileum. Deconjugation. One part reaches to the one part make one part reabsorb through the portal vein, and one part from the free bile acid convert into SBA, which again reabsorb into portal vein and then transported to colon, and excretion of bile acid in feces approx 500 mg per day. This figure is important. Nearly the 95% of bile is absorbed during the enterohepatic circulation. So let's come to the another topic, bile secretion. Mechanism of secretion. The secretion of bile consists of canalicular flow and ductular secretion. In the canaliculi, bile acid and sodium potassium ATPase contribute to bile flow. In the duct, epithelial cells secrete bicarbonate and chloride actively into the lumen. Mechanism of bile acid secretion. Bile is formed in hepatocyte. Bile acid are taken up from the sinusoidal blood by transport protein that are present on the basolateral membrane of the hepatocyte. In cytoplasm of hepatocyte, bile acid bind with bile acid binding protein. This prevents bile acid to accumulate in high concentration in cytoplasm. It should be noted that high concentration of free bile acid destroys the organelle of hepatocyte. Bile acid are conjugated with glycine and octoroin and then secreted into the lumen of hepatic canaliculi by facilitated diffusion. Bile acid moves into the bile down the electrochemical gradient. The concentration gradient is maintained by formation of micelles in the bile present in the canaliculi. Mechanism of water and electrolyte secretion. Water and electrolyte concentration of bile in the bile canaliculi is same with that of plasma. The bile duct epithelial cells secrete bicarbonate-rich fluid into the lumen. The ions are transported in the similar way to that of pancreatic extralobular duct. Modification of bile in gallbladder. Bile is continuously synthesized and secreted from liver and is stored in the gallbladder. Gallbladder is a small sac-like structure with a capacity of 30 to 60 ml. Gallbladder performs three functions: storage of bile, acidification of bile, and concentration of bile. So function of gallbladder mnemonic will be sac. Storage of bile, acidification of bile, and concentration of bile. Acidification of bile through hydrogen ion is secreted from gallbladder epithelial cell into the bile to make the bile acid. Concentration of bile as positive is secreted into the lumen of gallbladder in the exchange of sodium. For sodium transport into the cell, the gradient is created by sodium potassium pump located in the basolateral membrane of the epithelial. Water is reabsorbed from the gallbladder. Bile is concentrated. Look at the figure 42.3. H2O is taken up by the cells. Okay. From the lumen of the gallbladder, and sodium is also taken up by with excretion of H positive. Okay. This is sodium hydrogen exchanger. Or look at the sodium potassium ATPase, and this figure is over. Regulation of bile secretion. Bile secretion is influenced by choleretics and cholagogues. Choleretics, these are mostly asked in university and why also. The substance choleretics, the viva that enhance secretion of bile are called choleretics. The important choleretics are bile salt secretin and vagal stimulation. Secretin increase aqueous component of bile. Cholagogues, the substance that cause contraction of gallbladder to increase the output of the bile from the structure, are called cholagogues. The important cholagogues are cholecystectomy fatty acids. Cholecystectomy causes contraction of small muscles of gallbladder and empties its content. Function of bile. Biles are mainly due to presence of bile salt. Functions of biles are mainly due to presence of bile salts. Bile help in absorption of lipid from intestine by forming vessels. Bile salts in bile are important choleretics. Bile promote absorption of fat-soluble vitamins. Bile salt activate pancreatic lipids. Bile pigments are responsible for greenish yellow coloration of gallbladder that help to identify the organ, especially in small animal. Bile salts are physiological purgatives. Applied physiology. Gallstone, presence of gallstones are important. Presence of stone in the biliary tract, gallbladder and bile duct is called gallstone or cholerithiasis. Gallstone is commonly associated with 5F. Female 40 to 50 age, fair looking individual, fertile lady, fat people. Types. There are two types of stone: cholesterol stone and calcium bilirubinate stone. In USA and Europe, 85% of stones are cholesterol stone, pigment stone. Biles are along with the less thin solubilized cholesterol. Thus, they are prevent formation of stone in the gallbladder. When cholesterol concentration is high or bile concentration is less, cholesterol stone develop. Factors that favor stone formation are bile stasis, supersaturation of bile, nuclear factor. Bile stasis decrease bile flow or decrease gallbladder emptying facilitates stone formation. Supersaturation of bile with cholesterol. Okay, nucleation factor that favor formation of stone from the supersaturated bile. Glycoprotein in gallbladder. Mucus form the nucleus surrounding the gallbladder stone are formed. Usually cholesterol stones are big and maybe one or two stones are present in gallbladder. The calcium bilirubinate stones are multiple and more than 15 stones may be present in gallbladder of the patient. Feature: usually gallstones are silent stones, but when stones come out of the gallbladder, pass through the biliary duct, severe colicky or spasmodic acute abdominal pain occur. Chronic gallstone may present with acute cholecystitis, bile stasis, inducing inflammation of gallbladder. The stone may induce inflammation and edema of gallbladder, resulting in chronic cholecystitis. Gallstone may also present in obstructive jaundice. Diagnosis is usually made through ultrasound cholecystography. Clean X-ray may sometimes detect stone. Treatment is no effective medical treatment. Though many drugs have been advocated to dissolve stone, gallstones are treated surgically by removal of gallbladder. Cholecystectomy. Effect of cholecystectomy. Gallbladder is not absolutely essential for digestive function. The patient, those who have undergone cholecystectomy, maintain normal health, and usually their nutrition is not affected. Only problem face that steatorrhea. If they eat excess of fat food, cholecystectomized patient tolerate fat food to some extent. It decreases body fat and may be beneficial for obese people. Thank you. We have completed the topic. I'm signing out from this topic, biliary secretion. Thank you.